For many people, healthy living and weight control are typically near the top of their personal goals. For those who've struggled with obesity and just haven't found a successful solution, bariatric surgery might be a path to consider. We're checking in today with Dr. Sajida Ahad. Dr. Ahad is with Mercy Bariatric Surgery Clinic, where she specializes in obesity medicine and bariatric surgery. Dr. Ahad, thanks for joining me today.
Thank you for having me.
You know, we often hear about this worldwide epidemic of obesity, and it can lead to so many different health issues. Is that correct?
Absolutely. The way I think of it and the way it has been proven is that obesity or excessive amount of fat in relation to muscle mass is the mother of all diseases. It can cause diseases, it can exacerbate diseases, it can be a risk factor for cancers.
And so when we're discussing bariatric surgery, let's just start with the basics. What is that?
So bariatric surgery in its most simplest form is weight loss surgery. So it helps a patient lose weight and also keep the weight off. There are so many different procedures. There's no one size fits all. We actually at our program evaluate every patient, their struggles, the reason they want to have bariatric surgery, what are their goals and treatment options, and then tailor the treatment as well the recommendation of surgery accordingly.
Is it safe to say in the most general sense that you're making someone's stomach smaller?
Yes. All bariatric surgery would involve something done to the stomach, part of the digestive system.
And so who's a good candidate for this?
Anybody who suffers from obesity is a good candidate. Now, obesity is a disease. It's not a social or moral failure of a person. So that's the first thing. Disease has to be treated in different ways, and bariatric surgery is one of the treatment. When we say who's a good candidate, anybody who suffers from morbid obesity, which is defined as a BMI over 35 when they have a medical problem, or a BMI over 40 with or without a medical problem. These were set in by NIH in 1991, and these may be revised in the next few years by more insurance providers, but currently that's what we go by. Now, what BMI is, it's body mass index. If you're interested in finding out, it's very easy. You can go on the internet, put in BMI, and it gives you your height, your weight. You put in, and the normal number comes up. The normal is up to 25. So anybody whose BMI is between 25 to 30 would be considered overweight. Over 30 is obesity.
And is there an age restriction for this type of surgery, or have you treated people of all ages?
So there is an age restrictions in the sense that there are specialized program for pediatric obesity and pediatric bariatric surgery. We take patients 18 years and above, and we go up to arbitrarily, I would say, to 70 years, but sometimes we see a 72-year-old who's a good 72, almost like a 50, and they may be a candidate. So, but currently in our program, at least, we take 18 years to 70 years.
And what have you found in terms of this being a long-term solution? If people have the surgery, is it safe to say it's for their lifetime? It holds for their lifetime, or is it just dependent on the person?
First of all, I want to take this stigma away, the blame away from the person. It's not dependent on the person. You know, it's a disease. And just like any other disease, there are many factors. So what I tell my patients that obesity is a chronic disease for which we have no cure, only treatment. And that treatment comes in so many different forms. It's behavior modification, modifying your diet, increase activity, surgery, as well as medications. And there is not one treatment for it. However, we have known through the years that only bariatric surgery has proven effective in the long term for patients to keep the weight off, not just to lose it, but to also keep it off as well. Now, there is recidivism with morbid obesity. People, even however which way you lose weight, there is a tendency to gain it back. That's the chronicity of the disease. So yes, but now there are so many other options where we can fine-tune and help the patients maintain that weight loss.
Leading up to surgery is a process. And it's not like you see a patient and you schedule the surgery. So what comes in that in-between time?
A lot of that process is dictated by the patient's insurance carrier. And you're absolutely right. Unlike, for example, a gallbladder surgery patient that I'd see today and say, yeah, you need surgery, let's schedule the surgery in the next week or so. Bariatric surgery, there's a lot of education that goes on and evaluation. We want to make sure that this surgery is safe for the patient, effective for the patient, and they completely understand what they're signing up for. There is a free seminar that we currently offer to patients 4 times a month that they can sign up and kind of actually just learn about bariatric surgery, what it is, the risks and benefits. We evaluate the patient with the dietitian to make sure the patient understands all the dietary modification that they can do currently to help them lose weight as well as in the long term. There is psychological evaluation that's involved. And then depending on the patient's medical history, there may be other evaluations, consults that are involved. Again, no one size fits all, but that's in a nutshell what we would be doing for our patients.
So Mercy's program is accredited, and what does that mean in general and for the patient?
We are a center of excellence for bariatric surgery. And what that means is the American College of Surgeons has a program which is Metabolic and Bariatric Surgery Accreditation and Quality Improvement Program. It's a voluntary program. It's highly rigorous, and basically they want to make sure that we're doing quality work, we are trained, we have the resources, both human and physical, to take care of these patients, and that we are continuously engaged in quality improvement and patient safety.
How does this change someone's life?
So if you look at studies, 90% of the patients will say that their quality of life is better after bariatric surgery. I get a lot of hugs from my patients that I absolutely love.
I'm sure.
That, they cry with happiness because, and the only regret that any patient has ever had is, I wish I had done it earlier. Mm-hmm. That is the only.
That says a lot.
That says a lot. And that is something that I hear day in and day out. Like, I wish I had done it earlier.
Dr. Ahad, thanks so much for this conversation. And if people want to learn more, the website is mercycare.org/bariatrics.
Correct.
And we just welcome people to check it out. And if they're interested in learning more, the steps are there.
Yeah, thank you so much for having me. This was great fun.
Thanks, Dr. Ahad.